Okay, you're on.
All right. So, like I was saying, I will try to cover some of the fields that you guys talked about. And a lot of you are kind of undecided on what you want to do in medicine, and I am going to plug nursing for that because that is where I was. I liked a lot of things in medical science, but I had no idea what I wanted to do. I did CNA when I was in high school and kind of got into that field. Is anyone doing CNA or planning on doing CNA? Are you in it right now or planning on it?
Planning.
Very cool. EMT, anyone going to do it through high school?
I'm EMR.
EMR, so that's like the prereq, right, to do EMT? Okay, very cool. I highly recommend you guys do that to get some exposure in that field before, and it just kind of, you'll go do clinicals, but I do kind of do a little caveat to that. When you do CNA, you know that you're going to be going to like elderly, like SNF, we call it a SNF, that's probably the skilled nursing facility. So you're going to be specific to that field, and I mean a lot of that is basic ADLs, which are activities of daily living, which is like feeding people and like honestly like wiping bums and that kind of stuff. If you are not interested in that, don't be afraid to go into nursing. There's a million fields in nursing outside of a skilled nursing facility, and we're going to talk about that today. So last time I went off on a major tangent before I got to your assignment. So I'm going to start, can we start with the PowerPoint this time? Yes. I will tell you guys some stories, some things I'm going to go over. I'm sad none of you are interested in psychology, but I was telling the last class, a lot of you will go to school, and psychology is a prereq for pretty much anything in medical, and a lot of people get really interested in it in college. So I can answer a few of the questions from about that. Okay.
Takes a second.
So for this part, we'll get your assignment done. We'll get your questions answered for that. Oh, yeah. Okay, let me pull back. Okay. So who am I? My name's, like she said, Christie Hewlett. So I went to Weber High, and upon graduating, I went to Weber State to pursue nursing. I have experience in the ER, medical and surgical, but my greatest amount has been in behavioral health, so psychiatry. I've been a nurse since 2014. I graduated with my bachelor's in 2015, and then I went on to get my master's in nursing leadership in 2016. And I currently work as a nurse educator on an adult psych unit, which means I still do the clinical side, but I am much more in like an administrative role. I teach classes to prep people to work on my unit. And any latest and greatest stuff that comes out, whether it's new IVs, new pumps, any training related item, I have to get that out to my staff and then make sure everyone stays current on necessary things to work in the medical field, like BLS, that kind of stuff, the stuff that you guys are starting to work on. All right, so do you guys like Parks and Rec? Yeah. It's so cool, yay. Okay, so Leslie makes a lot of funny comments to her friend Anne. So look, nursing is easy, you just go to work, come in, and people come in and then you heal them. So it's basically nursing, that's my presentation. Not really. So it is not the same as CNA, that was my biggest thing. So like I did CNA and I really liked it, I thought it was fun. The class, I like laughed all through that class. I saw Mrs. Bird and she had like PTSD, I think, when she saw me. And I thought nursing might just kind of be an extension of CNA. I wasn't really sure what to expect. So like I went into nursing school absolutely blind as to what the program was. So I'm going to give you guys a really good idea of what you can expect and what the college route looks like. It's not what they show on TV. Do we have any like Grey's Anatomy, ER, any fans of the medical dramas? Yeah, so the doctor does everything in those shows, right? Like doctors with the patient the whole time and they're so concerned. Do you guys think that's true to life? No, doctors are in the room for like 5 minutes with the patient. If they have to do like a daily assessment, they probably don't spend more than 15. If you do nursing, you're with that patient for 12 hours. So doctors write orders and you do your assessment, you carry out orders, you do procedures. You are very involved. Pretty much everything you see the doctor doing on TV is actually what the nurse does. So we have expansive medical knowledge as a nurse. We obtain that from a 2-year college degree. So I was telling the last class, so before you can go to nursing, it's likely you guys are going to have enough prerequisites and credits to have a separate associate's degree. So I graduated in 2011 with a general studies associate's degree before I even got into the nursing program. I had to go to an additional semester to do the prereq, and then you actually get into the nursing program, and that's an additional 2 years. Did everybody know that? It's a lot of work to get into that nursing program. So we do hundreds of hours of clinicals. So this is such a good opportunity. If you guys, I really recommend after you do CNA or EMT, you can work in the hospital with those. EMT is a little bit more limited, but you can work in the ER as an EMT. You can work on my unit in psychiatry as an EMT. Great opportunity to get some exposure, to get some experience working with patients, to kind of see what you guys like. But I also tell people you don't need to bounce around. Like, you can have some job stability while you're in school. Nursing school is going to put you in every single medical domain possible that you have in that 2-year frame. Anything from ICU, ER, cardiovascular units, psychiatry. And then at the very end of your nursing school, you have to do, it's anywhere from 120 to 150 hours, and we call it a preceptorship. And that's basically you pick 3 fields that you're interested in, and then they place you with the nurse in one of those fields. So something that you, like ICU, let's say, you will go take over that ICU nurse's job for this many hours. So that usually shakes out to about 12-hour shifts, 13, 12-hour shifts, and you do everything. And it's very scary because pretty much up until that point you've kind of been shadowing or you've been working on mannequins in the lab. So this is very hands-on experience, and it's right before you graduate and become an actual RN. So I got to do mine on a surgical IMC, which is kind of like an ICU for surgical patients. So I got a lot of medical exposure. I got a lot of, we had a lot of patients crashed on us, and I realized that I didn't want to have gray hair in 5 years, and that job was going to do that to me. So you can kind of get an idea from this, especially like a real good, it's basically like a job orientation. And if there's a specific field you want, a lot of these the manager is very interested in hiring you after because you have so much experience already just in nursing school. All right, so after graduating, you can pick specialty. So there's a lot of misconceptions about what nursing school is, and myself included. I thought it was going to be very basic, like I was just the doctor's assistant and I was going to do blood pressure, like that's all I thought I did. In nursing school, you actually cover every field, whether it's OB, anything in medical. So when you're done, you can choose to specialize in that field, and you'll learn obviously more specifics and more about the pharmacology when you actually enter that field. But it's a cool degree for those that are like, I don't know what I want to do. Nursing is such a fabulous career choice because if you don't like something, there's a million other options. Nurses are trained to do patient assessment, but we do not give the diagnosis. I told the last class, and they weren't aware of this, but do you remember like Miss America where they like said, why did that nurse have that doctor's stethoscope on? Do you guys remember that? Has nobody seen this? Do you know what I'm talking about, Mrs. Randall?
I don't.
Oh
no.
my gosh. So anyway, it was very offensive to nurses, and we like on my unit, we all say, do you have your doctor's stethoscope? Because like we're the ones that are actually going in and usually listening to the heart. Doctors will do an initial assessment and check in, but that's something that you guys do every single shift. You're doing a full body assessment on your patients. So while we don't diagnose, we will get orders to do procedures, and you guys have quite an expansive medical knowledge, and you get to do a lot of things with it, whether that's pulling chest tubes, drains, removing stitches, a whole wide array. And there's also specialty training if you guys want to get more in depth. Whether that's like a degree level, like CRNA, which would be like a nurse anesthetist, or there's just specialty training. So like, do you guys know what PICC lines are, or central lines? Have you heard of those before? Mm-hmm. So it's basically that catheter, instead of going in like an arm vein, it's going like directly into the heart. There's like specialty training that nurses can go do that. That's pretty gnarly. I'd be scared to do that myself. So lots of options even in like the clinical setting for nurses. All right, so road to RN. We kind of talked about some of the classes you're going to have to take. It's micro, patho, nutrition, anatomy, math 1050, chemistry. So I told the last class, the fact that you guys have the opportunity, what is it called? Health Sciences 1120?
11, so it's 1110 and 1111.
10 and 1111. So we were that class is called Biomed, and there's some like classes that everybody kind of fears as they prep to go to nursing school because they're a little bit harder, and that's Biomed. If you don't choose to do Biomed, you can do a Nat and Phys. It's in the college level. Chemistry and math, those are the big 4 that people kind of struggle with. So the fact you guys can knock out Biomed or the health science class and Math 1050, it's still offered, right? The 1050 class. Do that now because it's free school and it's just less problematic. When you're in school and at Weaver State or wherever you choose to go to college, you would only have to worry about the chemistry and like the other basic, like the nutrition classes. Anything. I didn't think Weaver, does it still offer nutrition? My basic advice is if any of these classes that are prereqs for nursing, if you can get that done in high school, that is going to save you time and money in college. You'll still need to go take like English and the history classes and probably a psych class, but getting those core classes that are prerequisites, and these are the ones that really determine your admission into the program. If you get good grades on these, you have a good chance of getting into the program. But I myself, I didn't have a lot of these options, but anything I could take I did, and I got Math 1050 done. I have not taken a math class since I graduated. Weaver High And who hates, do you guys like math? I don't
No.
like it. Yeah. So I was so grateful to be done with that. All right, so nursing programs range from about 1.5 years to 2 years. Weber States is a 2-year program. If you go to Davis Tech College, that one's 1.5, meaning you go through the summer, you don't take a break. So that's something that can kind of help you determine what you want to do. I wanted summer off, so I went to Weber State. You graduate with your associates unless you are in a hybrid program. Some programs, like the University of Utah, and I think BYU, offer hybrid programs that you'll actually graduate with a bachelor's degree. They're a little bit longer and more intensive. So bachelor's degrees used to be less common in nursing, and the way things are going, I think by the time you guys are done with your RN, it might even be required that you need one. So I work at Intermountain Healthcare. We are asking nurses to have their bachelor's by 2022. And it's a good thing to have anyway, because there's floor nursing, and then there's opportunities on top of that, like charging or being an administrator. If you guys want that type of opportunity, you have to have your bachelor's. So what that looks like, if anyone's planning on going to Weber State, it's an additional year after you finish your 2-year program. And it's, compared to the nursing program, it's no big deal. It's like eating vanilla ice cream. It's going to be fine. It's just kind of a hoop to jump through to get that bachelor's, to get that BSN. So I did tell the last class, there are online options for your bachelor's degree where you could get it as soon as like 6 months, but I especially suggest that for this group. If you guys want to go above your nursing degree and maybe do NP, PA, something above nursing, those online schools usually only have a pass-fail scale for your grading, meaning you probably have like a B- or a C for your grade. So to be competitive to get into these schools, I would go to a traditional school where you can get A's, where you can have like a GPA. Does that make sense? Makes you competitive to get in. If you know that you're going to be done after your BSN, like an online school might be a great option because it's accelerated, it's faster. All right, so the last thing I talked about that I had no idea, one of the biggest things I had no clue about when I went into nursing school was the boards. Did you guys know you had to take boards after nursing school? If you did, you were way ahead of the curve compared to me. So it's called NCLEX. It's the National Council Licensure Examination for Registered Nurses. It's a really neat test, and you pay a lot of money to take it. It's about $350 to $450 to take this test, and it's anywhere between 75 and 256 questions, which seems really random. So how the test works, in nursing school, testing kind of changes as they prep you for the NCLEX. When you take a test like on paper, or if you take it in the computer lab, you at school, at least at Weber State, you can flag questions and you can go back. There was one that was kind of bugging you didn't think it was right. In nursing school, once you submit answers to questions, you cannot go back. And then the other common joke of nursing school is A, B, and C are all correct, but D is the most correct. So it's just very different the way that you're tested. And they also really like select all the apply questions, meaning they have like this statement and then check the boxes for each one that's true. And if you miss even one of the boxes on that question, you don't get partial credit, you get the whole thing wrong. So every time I got one on my NCLEX, my heart just sank. I was like, oh. So how the test works is you're going along, minimum of 75, but there's basically this competency level, right? And so if you're doing really well and you're staying above, you're answering the questions right, and you're staying above that competency level, you'll stop at 75. But let's say you're kind of bouncing, like I'm getting some right, and then, oh man, I kind of bounced below competency, I'm missing some questions, but then I'm doing well again. You will go through the entire test. There's a rumor, if you're kind of bouncing like that the last question will determine whether you pass the test or not. If you get it right or wrong, you pass or fail. I don't know if that's true, but you are at that point where it hasn't determined if you're fully competent or not competent. So it can end any time. Like your test will just turn blue when it's done. Like you could be at question 198 or you could be at question 75. The other fun thing they like to do to you is they have pilot questions that are very difficult, and they're testing them with you guys to see if they want to implement them in future boards. And nobody's test is the same. It's from a bank. So it's a really interesting experience. So when you go take this, it's almost like going to jail. You have to lock up all your belongings. They like scan your palm to look at your fingerprints. And then you just go in, and if you want to leave, you would have to raise your hand to go take a bathroom break. So when I went and took this, I had to pee because I get nervous. So I started like flipping through the questions. I was at like 60 and was like, I'll just take a break at 75. And my questions started popping up with things that I had never heard of. I had no clue what they were talking about, whether it was like labs or diseases. And I got to 75 and my screen turned blue, and I thought I failed. And I was like, I failed the NCLEX because I rushed the last 15. But I'm pretty sure they were pilot questions because luckily I passed my board. So that's something just to be aware of. I don't tell you all that to scare you, but I would have liked to have known because I didn't find out until like my 4th semester of nursing school, and I was like, oh, we have boards. All right, this is more Parks and Rec for you. So I want a janitor, they can do what you do, right? Yep, nurses and janitors are totally interchangeable. Not quite. All right, so let's talk about money. So big advice for you guys, if you do not like the medical field, if nursing's not your passion, don't go into it. It's not worth the money for what you guys do. You work really hard hours. Hospital especially, they don't take holidays, they never shut down. You're working a lot of swings, a lot of night shifts, missing a lot of holidays. But the median salary, and I would say this is pretty accurate as far as Utah goes. Utah's not known for being the highest paying state for nursing, just FYI. But about $65,000 for nurses. And then for nurses in the top 10%, and these are probably nurses that might have like further education, they might be in like a leadership role with a bachelor's degree, it can be up to like $94,000. And this is from the Bureau of Labor and Statistics. So looking down at this one, it really depends on the type of nurse you are. Do you guys know the difference between an LPN and an RN? So a lot of schools have actually phased LPNs out. At Intermountain, our hospital, or any of the facilities within Intermountain, we actually don't hire LPNs, but it's called a licensed practical nurse. So it used to be, some of the tech colleges still have it. After your first year of nursing school, you're an LPN. So you have limited ability, but you can still pass meds. You cannot do assessments, you can't do IVs, you can't infuse any medication. So you do have to have an RN that kind of supervises your work. And because of that, most people just like to hire RNs. But the LPN license, that's kind of what's making this range so low. It's about $20 to $35. So at Intermountain, I can tell you, we start our nurses out about $25. So it's much higher than the 19. And then the LPN, if you're working in that, most of those will be in skilled nursing facilities, and you might make anywhere from like 13 to 23. It can be more than that. And then charge nurse, that's more of a kind of leadership role. They can make up to 36. And this is just for like, so we're talking like bachelor's level. We're going to talk a little bit more about building on this education in other fields and how much money that kind of, what that looks like. So job outlook, is it good for nursing? Is it good for medical in general? Why?
It's never going away. It can't go away.
It's not going away ever, right? We're all made of organic material, we're all dying, like it's just a field that's always going to be growing. What some of the big things that are fueling it right now is we're living longer. We have more chronic conditions, especially here in America. We have a lot of cardiovascular disease, we have a lot of diabetes, people not making healthy lifestyle choices. And then we have a big baby boom population that's getting older as well. So our population in Utah and everywhere in the world, the population's building and building. It's just more people that are going to need healthcare provided. So job outlook is really, really good for anything really in healthcare, but nursing specifically, it's a 15% growth projected for 2016 to 2026. All right, so why nursing? If you like healthcare, like I talked about, and you don't know what to do, I would say nursing is one of the most diverse careers you can pick. Let's say you're not really interested in the hospital setting, but you really like research. There's a lot of nurse research positions that are involved with clinical trials and writing papers on what they're finding and publishing that. Nurses can get really into healthcare policy. Lots of law firms actually consult with nurses. You can be like a law nurse and look at kind of malpractice or neglect suits and kind of be a resource for the lawyers that are over those cases. There's forensic nursing where you can follow like CSI, or there's SAME nursing, which is a version of forensic nursing related to sexual assault. And then outside of that, if you wanted to build on that with like a master's degree, you can do a master's in leadership or management, and that's kind of the realm that I'm in at this point. I'm in more of an administrative and education field. You can be a professor at a university and actually teach future nurses in nursing school or teach CNA programs. There's a lot of opportunity just in general with administrative nurses as far as kind of elevating the field and pushing boundaries of what nurses can do and what they do in hospital settings. So beyond that, if you wanted to get like graduate school level, you have CRNA, and I know somebody mentioned that in this class, nurse practitioner. You guys pretty familiar with nurse practitioner? Yeah? Has anyone seen one before, or a PA maybe? So I'm going to kind of talk about that. So this is a really good alternative if you're thinking you really like medicine, but you don't want to be a doctor, you want something in the middle, and nursing may not be quite enough as far as the clinical skills go. This is such a great option. So I'm going to compare the two. I'm going to compare NP and PA. I thought more people would have questions about it, but I'll talk about it anyway so you have an idea of what's going on with that. But same with nursing. Nurse practitioners can kind of go into a specific field. So there's women's health, psych. A lot of people on my floor are working on their psych NPs, and it's one of the most lucrative NP positions as far as salary goes. A few of them already have job offers, and they're going to be, and this is just starting out, they're going to be making about $120,000 a year. So it's a really good, it pays really well, and if you have an interest in that and don't want to be a psychiatrist who is actually a medical doctor who goes above and beyond to get the psychiatry residency in, that's a really good option. There's also geriatrics, family, acute care. Family NP is basically like the doctor that you go to at Instacare when you're sick or if you need like a sports physical. They do that kind of family medicine, basic stuff, nothing specialized. All right, so NP versus PA. So nurse practitioner, physician assistant. As far as the pay goes, it's actually pretty similar. And honestly, like even the skill set and like what you're doing, it might look really similar, but there's some key differences. Nursing in general is a very holistic profession. We care very much about people. We like to look at not only their diagnosis, but them as a person. What's going on in their social life? How are they doing mentally, emotionally? What's going on? Where PA is a little bit more diagnostic, like there's a problem, let's diagnose it, and here's a medication, or here's, here's your plan, you're out the door. And that's not to say that those don't mesh, but that's just kind of the basic difference of the outlook both of them have. So autonomy, this is a huge difference between the two. So PAs have a really high level of independence as a physician assistant, but they always have to have a doctor over them. So what this looks like is they might see patients on their own, and they might do diagnoses, they might prescribe medications, but a lot of that has to be run through the physician before it's actually in place. So for instance, like a medication, if it's like a controlled medication or something, a PA cannot prescribe that. It would have to go through the doctor. So some limitations there. NP, you have a lot more autonomy, a lot more freedom. You can even have your own practice as an NP. You don't have a doctor over you. The only caveat to that is once you graduate, they might have to follow you for your first 1,000 hours of care, which you might feel pretty good about as a new provider, right? After that, you get to go to the full extent of your education. You get to treat patients without having a physician over you. And if it's something that's out of your scope and whatever your specialty is, you just refer that to a physician. So kind of cool. Some of the things to note, the schooling is about the same. It's about 3 years. NP, you have an option to do a master's or a doctorate, so you can literally be a doctor nurse. That as far as that goes, they are leaning more towards doctorate these days than masters for NPs, and that's an additional year of school. If you get your doctorate, you have more autonomy with like research, you can publish, you can teach fellow NPs. One of the big things with PAs that I tell people to consider is you have to redo your boards every 10 years. You have to go back. NP is one and done. You get your boards done, you don't go back. So why is that a big deal? Tests are not fun, they're expensive, and let's say you went into dermatology, you still have to go back and take a boards that's going to go over everything, from cardiovascular to neuro to anything, musculoskeletal. So that's something to keep in mind. But as far as specializing, they can do similar things as far as going into different fields, PAs, anything where there's a physician. You can even be a PA and work with a surgeon. There's lots of options, and same with NP. But that's just something that I kind of take note of. And then it is a little bit faster to go the PA track, because you just need a bachelor's degree, and then you go into PA. So you could literally have a bachelor's degree in music, and be like, oh no, I really do like medicine, and you could go be a PA. Nursing's a little different. You'd have to go to your 2 years of prereqs and possibly, since you guys get so much done in high school now, maybe just 1 year of prereqs, 2 years in the nursing program, and then a bachelor's degree, and then you can do NP. NP usually wants a couple years of experience, which is kind of nice. If you're thinking about that, you're really building up to like higher and higher levels of care, right? Because you've been working with patients since you were a CNA, so by the time you're an NP, you've really kind of taken steps to get to that level. So not quite as immersed as you would be if you went from like a musical degree to like medicine as a PA. Okay, so what to do now? And this is kind of where I'd like some interaction from you guys is as far as like career goals and what you want to do. But I would say in high school, if you have an interest in the medical field, and while it's free, get your CNA or your EMT. Like I said, there's a lot of positions in the hospital that will accept either one. I will say CNA has more versatility and it's easier to keep up. That would be my only thing with it. EMT is a little bit more work as far as upkeep with your licensure. CNA, if you show up to work for 200 hours in a 2-year period, you get to renew your license. So things to get done now would be med term, chemistry, anatomy and physiology, biology, and other medical classes. So the fact that you're here, you've got a great start. And it sounds like a lot of you are planning on doing the CNA or the EMT. And then get experience, whether that's, a lot of times we like you guys in the hospital setting to have experience somewhere, whether that's a nursing, like a home facility, like a SNF. But we can hire you right off the bat as a CNA to the hospital. It's kind of a jump as far as skills goes from like what the class does to what you do as a CNA, because you'll be doing a lot more. You can like empty wound drains, you'll be dealing with catheters. If you work in the ER, you can actually do IVs. CNAs can become scrub techs and help with surgeries in the hospital. So what I wanted to kind of end on is if your ultimate goal is neurosurgeon or CRNA or nursing, don't beat around the bush, just do it. I have a lot of people that I work with that are wanting to do nursing, but they're doing scrub tech school or they're doing MA school. You are paying a lot of money to go to school to make less, and it's the same amount of time. So does that make sense? Go to school and just go right for what you want. Get your CNA and you'll have a job in between. And I would just say do nursing. MAs are awesome and you're going to be just as smart as the nurses and you'll be like, oh, they make more money than me and I do the same thing. So that's my one gripe about MAs. Other positions in the hospital that I was wondering if you guys were interested in knowing more about would be paramedic, respiratory therapists, radiology technicians. Anybody kind of interested in that at all or want to hear about it?
About what?
So respiratory therapy, radiology technologist. I know somebody wanted to be a radiologist, which would be like a doctor level. A lot of those types of jobs kind of have a shelf over them. Like if you get that degree, awesome, it's usually a 2-year degree and a bachelor's, but you can't build on it like you can with nursing. Like there's no master's for education or leadership or CRNA or NP. So if there's any chance that you guys know that you will want to do more or maybe possibly want more in your clinical scope of practice, I would really highly suggest doing nursing. Okay, do we have your papers for the most part covered?
Yes.
Yeah? All right, so I don't think I had one question from you guys. So basically what I did in the last class is I started talking about what I do on behavioral health. Are people at least kind of interested in psychology? It's very, like, anybody taking it in high school, do they offer a concurrent or anything with it?
Yeah.
Anybody, are you taking it?
I took it last year.
Oh, did you like it?
Yeah.
It's very interesting, isn't it? So we are all touched by psychology, like whether we like it or not. We all have a brain and it can malfunction and it's affected by the environment. So it's a really fascinating field. And I was kind of talking about how personality type really affects what you want to do. So I would start taking note of what you're comfortable with or what type of, like how you interact with people. Are you more assertive? Are you a little bit more laid back? When I started out as a CNA in the hospital, I worked in the ER. What type of personality do you guys think you will see there?
You can't be grossed out easily.
No, yeah, you gotta have an iron stomach. So I would say ER people are very type A, very assertive, my way or the highway. And if you think about it, if you're like bleeding out from like a car crash or something, that's the type of person, not like the, are you okay, like timid, like you want somebody that's gonna fix you. And I worked well with that type of personality, but the environment was very, very like autonomous, like dog eat dog, kind of like you take care of your own business. And I was like, oh man, this is exhausting and scary. My first day as an ER tech, I wasn't even trained, but like, you just need to go clean that room. Your trainer will be here in a few minutes. So I was like, oh, okay, like by myself. I'm like, yes, just go clean it. And I was like, okay. So like, I go in, I glove up, I start wiping things down, and I'm like, I'm doing such a good job. I'm living my dream here in the ER. And I made my way over to the trauma sink. And in the trauma sink, in a bag, from the knee down to a like hiking boot, was a man's hairy leg, just sitting in the sink. And I was like, do I clean that too? Like, do I throw this away? What do I do? So I like picked it up. It was so weird. It was like Indiana Jones. Am I getting blurbed?
I'm just gonna.
Oh, okay. I picked it up and like right as I picked it up, an OR tech ran it and was like, I'll take that, thank you, and ran back out. And I was like, okay, this is a really interesting field. So I probably would have stayed there long term, but my job actually got disintegrated, and it was basically one of those situations where like you can either not have a job anymore or you can go work on psych. So I was like, oh, okay. So I went over to psych to just give it a shot, knowing that I was almost done with nursing school and thinking I was going to leave. And the first thing they did on our tour was literally they took us to the padded rooms, and I didn't think that that was a real thing. I thought that was kind of a movie set type thing. Walked us right in and like, go ahead and punch the wall, it's rubber, it won't hurt your hands. So I'm like punching this rubber wall, like what am I doing here? And then the next thing they showed us was restraints, which I also thought was kind of from movies, leather restraints, and that is still used. So it was a very different vibe in psychiatry. You need to be very patient with people. It's very team-oriented. A lot of times people on psychiatric wards do not want to be there, and they're legally held there or held there on a medical hold by a physician. And how happy do you think that makes them? Not at all. On psych wards, we take people's shoes, cell phones, pretty much all personal belongings, and they can only wear clothes that they brought from home, and that's the only thing of their own personal effects. It's just a very different field. And then you're also throwing in that people might be psychotic, hallucinating, having delusions. So you have to be very comfortable working with people, and you need to have good communication skills. I was telling the last class, it's a very, you get very in-depth very quickly. So if you're uncomfortable with having kind of deeper conversations, it's not the field for you. One of the nursing assessment, we do a physical assessment, right? Everybody still has medical problems, but we also do a mental status assessment. And kind of the 4 questions we use to get the conversation rolling are like right off the bat kind of hitting deep-seated issues with these patients. Do you have depression? Yes. Tell me about it. How bad is it? Do you have anxiety? Yes. Tell me about it. How bad is it? Do you have suicidal ideations? Yes. Tell me about it. Do you have a plan, or is it more passive? Tell me what's going on with that. Do you have hallucinations? Tell me about it. Are they visual? Do you smell something? Do you hear something? Do you see something that is not there? So very in-depth, kind of heavier topics that are a little bit more uncomfortable for people to open up over. And it's a very united group, I think, on psych. Our patients aren't always nice to us, so we're really nice to each other. And if somebody's yelling at me, I know I have like 3 other nurses behind me just kind of sitting there in case I need help. The training is a little bit different going into psychiatry. We do less with IVs and pumps beeping at us. We do still take care of medical needs, but mostly we're there for the mental, right? So the training's a little bit different. We talk a lot more about how you communicate with people effectively. We talk about self-defense and staying safe in violent situations if we have an aggressive patient. We talk about communication techniques, holds that we have to place people in. We talk about how you place restraints, what we do with people in seclusion. So does anyone have any questions about like diagnoses in psych? Everybody's affected by it, right? Like I feel like it used to be a lot more taboo to talk about depression and anxiety and having that be an issue, or even suicidal ideation. But I feel like it's getting a little bit more cleared and it's more normalized. We also, one of the other new things that's really cool that's changing about healthcare with psychiatry is we have an access center. Has anyone been to McCady Hospital, like ER area? Did you see our access center? So it's been there for about a year, and it's right next to the ER. No?
Oh, yeah.
It's like green,
yeah.
kind of? Okay, so we have access centers that are being built that are kind of like behavioral health emergency rooms. So people, I kind of explain it like an Instacare, like maybe you're like sick and dying, but you're not like ER sick and dying, so you'll go to the Instacare, right? It's kind of the same with behavioral health. Access center is like somewhere where they can walk in and we try to take care of it within 23 hours and send them back out. If it's determined that they're suicidal, that's like the biggest criteria to get onto my unit is suicidal ideation. Then they'll probably be admitted. But if it's something we can take care of more as an outpatient basis, we do that. It is for adults, so if you're a minor, which you guys are, or 18 above, if you're 18, you can be seen in the access center. But that's kind of a cool resource and a change as far as like normalizing these issues. Because like everybody has known somebody that's dealt with serious depression, anxiety, suicidal ideation. Like we all know it, and I think it's becoming more, normalized to go get that taken care of. And really, I tell my patients all the time, I say the only difference between you and me is I have a badge to get in and out of this unit. Stuff that people come in for, if you have like a bad day, like where you lose all of your family in a car accident that you caused or something like that, or multiple like traumas, like anybody could end up on my unit feeling very down and depressed and just lost. So the next, you guys interested in drugs?
Yeah.
Okay. I asked Mrs. Radel and she said I could talk about drugs. So this is like Christie's Scared Straight program to not do drugs. So I was very naive. I had never seen any like hardcore drugs before I went and worked in the ER, and I was exposed to everything from cocaine to heroin to meth. And I was usually like, what is this? And the cop would be like, no, grab it and confiscate it and go get rid of it. So I'll tell you a story about meth. We have some people that are into oral surgeon and orthodontist, right, or dentist. So we have people that are into that. What does meth do to your teeth? It rots them out of your head. Okay. So I had a patient. We have a psychiatric intensive care unit, and I had a patient back there that was. What happens when you're on meth? I'm sure you've heard the term tweaking. You literally turn psychotic. You're gonna have hallucinations, delusions. It's entertaining sometimes, also scary sometimes as a nurse. And then after that, they kind of have a crash and fall asleep, and they normally wake up fine. Some of them have done it so much, or even one time is enough, and your brain is forever fried, and you can literally induce schizophrenia in yourself if you try meth. But anyway, this patient woke up, wasn't as delusional, was doing pretty good, and it was visiting time, and their mom came in, and I was like, oh no. Just skeleton face, like eyes sunken in, and she smiled, and I was like, oh, like her teeth were like Yzma's off of Emperor's New Groove. I was just like, oh my gosh. And she came up to me and was asking me some questions about the care of her loved one. And as she was talking to me, she flicked her front tooth out with her tongue. And it like landed on my desk, and she was like, can you believe that happened? And I was like, yes, your teeth are rotted, ma'am. So obviously that was like the drug problem had gone through the family. Everybody was kind of having issues with it. The other common one that's interesting for people of your age group to note is don't fall for peer pressure. One of the common things that we'll see is people will go to college in their first year and try drugs, and they end up on our unit. So whether it's like LSD or Spice, you guys have heard of Spice?
No.
Well, that's good. So that one's a synthetic drug, man-made, and that one actually doesn't show up on like our drug screens, but we know that you're on it because you are absolutely psychotic, and it's another one that you can actually like change your brain chemistry so much from the use of it that you do not return to your normal baseline. So we have, the latest one we had was a pre-law student at the university. I won't say where, it's not
Utah.
somewhere. It was pre-law, and some friends tried LSD and told her to try it as well. Ended up on our unit, completely psychotic, show tunes on the unit, wouldn't keep her gowns on, so ran around naked a lot, us chasing her, trying to keep her clothed. She did a flying squirrel move where she would naked jump on people and like piggyback. So like you'd walk over to your best friend who you're tight with and be like, hey, can you get her off of me? So it took her 3 weeks of being on antipsychotics to get her brain chemistry and her baseline back to normal. And a lot of times patients will remember the event. They'll remember like talking to you. She probably remembered she was running around naked. So not a lot of eye contact with her when she kind of woke up from that drug-induced state that she was in. Completely embarrassed. It was on her record with the school because she couldn't go to school because she was in a psych ward. Really could have messed up her life. And we see this actually pretty common. People will try these drugs, and sometimes like her, she was lucky, kind of got out of it, moved on. I'm sure she will never experiment with them again. But we see other ones that, like I have patients that will periodically come in. We cannot get them back to their baseline. We do our best to kind of stabilize where they're at so they can function in the world. But and usually they might relapse, have issues with that. But like it's very, very sad. Drugs are extremely dangerous in that sense. We also see substance abuse in regards to medications. Like you guys have probably heard more of a push about people abusing like meds you get from your doctor, right? Like opioids or narcotics, whatever you're getting. So we've done a lot to try to limit how much we give for procedures. And we've also changed how pills are formulated. Did you guys know a lot of them, if you crush them, they just turn into goop? You can't really do anything with them. That is real. You can't ingest them in any way. So if somebody's addicted, what might they do if we take away their ability to get it from a physician? They might find it elsewhere, right? So what might be a common drug you see on the street if somebody was addicted to opioids? Anyone know?
Oxycontin.
So Oxycontin stuff that you might get from a physician, but heroin. Have you guys heard of heroin?
Yeah.
So that's like it's in the opioid class, right? So if they're not able to get this from their doctor anymore, they're addicted, we see people turn to heroin. One of the worst, as far as like ruining a person's life, drug I have ever seen is heroin. Even when they're successful, we do short tapers, meaning we safely get them off of the drug. Even sometimes if they do long-term therapy, the most effective way to get off of it is like a 2-year program where they're changing the people that they hang out with, they have to maintain a job, they're getting a form of a pill that basically goes on the same receptor but it's legal. Even with that, it's really common to have relapses, and some of them can't ever get off of that pill that we give them. They have to take it the rest of their lives. It's extremely, extremely addictive, very, very sad to see that. And those with heroin users, that's where we kind of see the track marks on the arm from actually injecting it with needles, and what comes into play when you're using dirty needles.
STDs.
HIV, hepatitis C, all sorts of infections. So not only do they have like no quality of life because they're addicted to this drug, they also have secondary illnesses that come from it. So has anyone taken like any sort of narcotic, like wisdom teeth or some sort of surgery where you took a pill? Anyone kind of have that experience?
Yeah.
So like sometimes you'll hear from your friends or somebody, they're like, oh my gosh, I just felt really good on that pill. And some people will have the opposite experience. A lot of it's your genetics, how you're going to respond to that. I come from a family of lightweights. So I took Loratab after I had my wisdom teeth out, and my sister found me on the floor on my stairs with Go-Gurt in my mouth, and I was sleeping, and she said, how long have you been here? And I said, I don't know, and I don't know how I got here, so I never took it again. Other people might use medication and right off the bat have some sort of like, ooh, I kind of feel good on this. Be very aware if that's you. Be very aware if your family has addiction in its past, because it plays a huge part. Your genetics play a huge part in how you're affected by alcohol or other drugs. I'm going to talk about marijuana for just a little bit, especially now that it's more of a prominent issue as it's been made illegal for medical use. So complications with the new law is it is not federally, like as a country, it is not legal. It's at a state level. So we cannot have, like pharmacies cannot be carrying this because they always have to go off of the higher law, which is in our country, right? So that leaves some room for abuse. And that's not to say marijuana, like studies have shown that it does help with seizures, like it can help cancer patients have an appetite again. There's a place for it in my book. But abusing it is very, very dangerous. Studies show that, you guys have heard the term gateway drug? Extremely common with marijuana. I've had patients that I've seen come in and we look at their drug tests, marijuana, and then it might go marijuana meth. And then it might go marijuana, meth, heroin. And then it might go marijuana, meth, alcohol, and, and it builds and it builds. So it's that addiction building, and it's also people chasing that high. So when you take a drug and you feel the effects of it, it's never going to be more potent than that first time, but it's that your brain is just latched to it, so people will chase it, and it becomes extremely dangerous. One of the scariest things on our unit is we'll taper people off of this drug, and they might be clean for a while. But what happens is we take any sort of medication or drug, what does our body kind of build? We build a tolerance to it, right? So we will get people off of this, and then they might decide to relapse, and if they go back to that dose that they built up to, what's going to happen to them? They will overdose. They will die. Literally, you will shut off your brain will not tell your body to breathe. So it's very scary for us with patients that relapse. We try to teach them that. And one of the big campaigns, have you guys heard of Narcan? Anyone know what that is? So a lot of pharmacies are selling Narcan now, and this just blows my mind because this just so used to be hospital level or like paramedic level, but they will send you home with Narcan. What Narcan does is it basically, the opioid receptors we have in our body and our central nervous system, Narcan is a drug, if you inject it, it kicks that off the receptor immediately, making you effectively breathe, right? So if we've seen in the hospital every once in a while, nurses might give a little too much medication to somebody and we're like, ooh, like we kind of tanked the respiration. So we might push Narcan. That drug is so potent that we'll push it and that patient will wake up screaming in pain because we took it off of that receptor. It has a really short half-life, but people that go home with any sort of Percocet or any sort of medication for pain, pharmacies are actually offering Narcan to take home to prevent overdose, which just blows my mind that we're kind of at that point. Yeah. An addiction, I mean, even on our unit where people are at a point where they want help, they're seeking to get rid of this addiction. We've had people that have snuck in like flasks of alcohol, and we're actually treating them for like alcohol abuse, so we're giving them medication that's on that receptor in their central nervous system that's preventing them from having a seizure, because alcohol withdrawal can actually kill you. Did you guys know that? You can have a seizure and die. So anyway, like we had this patient, we were treating him for alcohol withdrawals and like medicating them, and they drank drink from this flask, they were so sedated that they like were standing straight up and just went boom right onto the ground, broke their nose. I don't know why family thinks they're helping by, you know, kind of helping them with their addiction, but it's very, very scary stuff. So I can talk about a little bit, is there any like diagnoses that you guys like, I think an interesting one, especially when you go to like your psych classes in schizophrenia, you guys know what that is?
Yeah, my uncle has that.
Really? So can you kind of tell us about what it is, like symptoms and?
Well, isn't it like, you're thinking like something happened or about one thing, but it really isn't? Like, cause like with my uncle, well, it's not my uncle, it's like my great uncle, so it's my grandpa's brother. So, my grandpa has this well in front of his house that he's always had, just a water well.
Mm-hmm.
And when my grandpa's grandpa died, so my great grandpa died, my uncle had this thought in his head that my grandpa stashed his body in the well.
Mm-hmm.
So one day, in like the middle of the night, my grandpa just heard like all this banging and stuff, and his brother was like trying to dig up the well, like trying to, like, cause he thought the body was in the well.
Right. So when you learn about these things, you kind of think, this is not real, or this is just like on TV. I remember thinking that I thought somebody was acting the first time I saw a paranoid schizophrenic, because I'm like, they cannot be serious right now. It's mind-blowing, like how broken. Basically, schizophrenia is like a broken brain. So that would be a delusion. So a delusion is a false thought, like a false, so you're believing something that's not true. So some of the common delusions that I see, government's after me, you're projecting your thoughts in my brain, or I'm projecting mine into yours. We're all on a TV show. That one's kind of fun when your patients think you're on a TV show because they're happy. So you're just like, yeah, let's sing and dance. Then there's a hallucination. What's a hallucination?
See something or hear something that's not
Smell
there.
is a sense.
Yeah.
It can be, it smells pretty uncommon, but yes, you are experiencing something. And the funny thing, 9 times out of 10 when I have patients that are hallucinating, they will not own up to the fact that they are. A lot of times it's them yelling at people that aren't there, because they can kind of have happy hallucinations, but it's also common to have very degrading voices in their head, and they can actually become violent or even mad like their care providers because they're hearing these voices. They can get the delusion and the voices and think that you're colluding against them. They can be like, I heard what you said about me and my mom, and you're like, what are you talking about? Very, very interesting, some of the thought patterns that they have. So this is my scary story. Are we almost out of time?
We have 14 minutes.
Oh, we have a lot of time.
Yes.
Well, I'll tell this one first. So I hear a lot of people saying the government's after them, and so I just had this patient telling me all about the FBI, and I was like, and I was like taking notes. And I was like, clearly psychotic. So I was like doing all my charting, and his dad came in for visiting, and he's like, yeah, and it's just been really hard for our family because of the FBI, like, talking to us every day. And I was like, oh, excuse me? I was like, what? Why is the FBI talking to you? And they're like, oh, well, he made threats against President Obama and called the White House, and so we're being investigated. And I was like, oh, so I had to go delete all of my charting, and I was like, I'm very sorry, but he still was very psychotic, that man was. So I had to go back and change all my charting. A lot of schizophrenics, when they're seeing stuff, like when they're having like visual hallucinations, they don't like to talk about it. They might just be very reserved. Even when you're talking to them, they can kind of be looking elsewhere or like in the air, talking to somebody else in the middle of your conversation. It's very interesting to me, the commonalities and stuff that they'll describe. And like, if you look this up in like your psychology books, their artwork is also very similar, which just is so weird to me. A lot of times they'll draw like hands with like faces on the fingers. They'll describe seeing like demons with like red eyes and like a black cloak, just kind of similar like visualizations that they have. And delusions kind of can follow that same pattern as I talked about. So this is my scary story. So I had a schizophrenic, lots of hallucinations and delusions, and he had kind of been diagnosed into like a sociopath level of personality disorder. Which means you have like a lack of empathy, meaning like it does not matter if somebody's crying. You do not sense that something's wrong, right? Like the right and wrong and moral code of like humanity just doesn't kind of exist in that personality disorder. So I was talking to him. He was brought into the unit because he had skinned his neighbor's cat and hung it from their barn. And so I was just kind of, and like I mean, he was pretty clear talking to me. I didn't feel nervous around him, so I had the door shut and he was in his room doing his assessment, kind of talking to him about what's going on. And he's very like, I'm fine, like everything's good. And I was like, okay, well, can you kind of tell me about like what was going through your head when you did that? Because like that really scared your neighbors, you know, obviously. And he goes, well, yeah, like the voices in my head told me to do it. And I was like, oh, they did? And he's like, yes. He's like, how else would I get my power and my energy source? And I was like, oh. So I was like, so the cat gave you power and energy? And he's like, yes. And he's like, well, you know, the voices actually told me to kill a human, but I don't think I need that much power and energy, so I killed the cat. And I was like, okie dokie, and I like opened the door the rest of that assessment. So you can have very scary diagnoses. So while my unit, we're very acute here, we try to fix things within a week, but every once in a while we will get people that are so sick with schizophrenia or other problems and they're not responding as well as we'd like them to with antipsychotic medication, that we have to send them to the state hospital. So that's down in Provo for Utah, but every state has one, and people can be there for up to like 1 to 2 years, trying to get them at a baseline where they're going to be safe on an outpatient basis. Most of our people we can get outside of the hospital and we can get them into like, you know, the care of a psychiatrist and they can function and live normal lives. And these are obviously like extreme cases. Like we have on our normal unit, it's people that are dealing with, you know, stuff that we all deal with just in a more extreme level, whether that's anxiety, depression, suicidal ideation. One other thing that I think is interesting that I didn't know we still did, it seems very archaic to me, is do you guys know we still do electroconvulsive therapy? Have you guys seen like Beautiful Mind or anything where they like shock him and they're trying to fix his brain by shocking him? I thought that was so kind of, you know, the history of psych is very sad. Like people were just kind of thrown into asylums, and a lot of times they might have just like had an actual like medical ailment that made them different, and they're like, well, you're just crazy. Anyway, so I thought that this electroconvulsive therapy was like so outdated, like we don't do it anymore. We actually do it, and it's an effective treatment for PTSD and depression. One of the most interesting things for psych for me is a lot of things that we do treatment-wise, we don't know why they work. Because the brain, we're all about, you know, chemicals, right? Neurotransmitters in our brain. So a lot of stuff that we do as far as medications go, we're affecting the chemistry of your brain. So like for depression, for people, you know, I still think there are people that are like, well, depression, you just need to, you know, buck up, you know, tough it out, like, don't be sad. You can actually see, like, physically in the brain, your frontal lobe can shrink with depression. Like, there are physical things that you can see, but a lot of the medications, like, it's a lot of guesswork. And some of the cool things that we're doing right now is gene testing. We will gene test people to see what, based off of like how they'll metabolize and what enzymes they have in their body, how they'll metabolize medications, and it eliminates some of the guesswork that we do with psychiatric medications. But a lot of it, so with ECT, what we're basically doing is, what is a seizure? You guys know?
It's a disruption of your
Causes you to kind of convulse, or you can kind of have an absence seizure, but it's basically like electric activity in the brain, right? So when we induce that seizure, it affects the levels of your neurotransmitters, and it can effectively treat depression. So there's a limit on how often we can shock people, and we put you to like sleep, like we don't do that at where I work, but we'll send you out, we'll refer you to go get it done. But they'll put you to sleep, they'll induce a seizure in your brain, and that can effectively treat your depression. Isn't that wild? So for a lot of people, it can last up to a decade, but they do limit how many times you can do it, because obviously, like, seizures are an intense thing, and like there are risks to that procedure. So I've had a couple patients that are, you know, in their later years, their 60s or 70s, and they've done it 3 times and they can't do it anymore.
I was just curious, like, what is psychosis? Isn't it kind of similar to schizophrenia?
Yeah, so psychosis is any state where you are not of your right mind, basically. So like whether that is like that you're having delusions or hallucinations. So a lot of what we do is figuring out, why do you have psychosis? Is there like an underlying problem? Because are there like medical issues that cause psychosis?
Yeah.
Babies, ladies, I've seen some very scary things with postpartum psychosis. So we've all kind of heard of postpartum depression. Mm-hmm. It can become to a psychotic level. Some of my most interesting patients, like we thought this one lady was speaking in tongues, like she was doing weird rituals. They can clear up like that. And their husbands are like, what's wrong with them? And they have a new baby they can't take care of. But she cleared up like that, remembered everything. And I was like, what were you speaking? And she's like, oh, I served a mission in Finland. I was speaking Flemish. I was like, oh, okay. It's like it wasn't some ancient, you know, ritual. But that is very cool for me to see somebody that is so far off the edge, like psychotic, and then you can completely see them turn around and go back to a baseline.
So psychosis is only temporary then?
Depends. How much drugs have you taken? Or, you know, some people can have schizophrenia to the level, and especially if they haven't been treated. that it's, your baseline's not great, and you might have to function. Some people can function and be like, you know, law professors or lawyers, like doctors, and they have voices that they can't ever fully get rid of. So you can still function with psychosis, but a lot of what I see is that drug-induced or like they have not been taking their medications. A lot of our homeless population have schizophrenia, and there's a correlation there, right? And a lot of them turn to drugs to kind of self-medicate themselves, but maybe it's the schizophrenia that's making it so they cannot function and have a job and they become homeless. It's kind of sad. It's kind of one of those things that which came first, chicken and the egg, but we have a lot of homeless population that deal with psychosis, and they're the ones, we can actually legally commit them to get treatment on an outpatient basis, because if they go off their meds, they just end up back with us actively hallucinating. When they're on their meds, they can actually function. So a lot of psychiatric meds are really hardcore. There's a lot of side effects, so there's a really big issue with us getting people to be compliant with medication. So that's one of the issues we'll see, and we kind of have a frequent flyer problem of like, hey, like you had another psychotic break, like we have to get you back on your meds, you got to take your meds. What was your question right here?
I was gonna say, are there side effects from like that shock therapy, like when like to treat the depression?
So there can be major, side effects from that. Honestly, none of my patients had any issue. It's literally like they went to sleep, had it done, have no memory of it, and wake up and they kind of, and you know, it's not as always as effective for some people. Some people will do it once and like, that did nothing, I'm not doing it again. Yeah. Most of the risks though are just controlling the seizure and then like basically stopping that activity in the brain. With psychiatric meds though, we see a lot of issues. I don't know how much you guys know about like akathisia or dystonia, basically where you can't control your movements. But long-term use of like psychiatric drugs, if you ever see like homeless people or people at a store and they just are like this, it's like that could be a very common in my field to see that. It's the side effect of long-term use of antipsychotics, which is also a reason you wouldn't want to take them. It also makes people really hungry. It's really common for people to like balloon after we started on their medications because they can't stop eating. Whatever that switches in their brain, they just have the munchies. So it's a difficult thing. It's kind of, when you see these types of things, like you guys can actually be gene mapped and kind of see if you have a predisposition for these mental illnesses, which is kind of scary. Like, do you want to know or not, you know? For guys, it's usually early 20s that we see that they have some sort of psychotic break, and then women, we're mid-20s to like late 20s, we see the same. They're going to have some sort of issue or personality disorder or something like that. And they're definitely treatable. Like you just need to go in and like kind of face that you have that issue, and some of it you do have to live with, but it's just the same as somebody like having to work with having diabetes or, you know, anything. We all have our medical problems. Any other questions? Are we close? I feel like I'm talking to death.
I had a question. I've heard the Weaver State Nursing School is so hard to get into. Can you explain that?
Yes, Mrs. Riddle, you're right. It's very competitive. So basically, to have like a really good shot of getting in, you guys need to have your prereqs done, competitive grades. If you had a B- or something, you're probably okay, but if you were to retake a class, I would say you need a B- or higher. Definitely if you have a C, it's technically passing, but to be competitive to get into nursing, I would say you need higher. Once you're actually in the nursing program, you have to have a B average to pass. You have to have an 80 or above, or you do not pass that class. You'll have to retake it. So prereqs is something they take very seriously. You can start now with having good grades in your high school concurrent enrollment classes, and just be competitive with that. Other things they look for is experience in the healthcare field. So if you get your CNA, that's a point right there. You actually have to have your CNA to be in nursing school. Forgot to mention that. And then if you have experience, they really, really like to see that you've got some hospital or skilled nursing facility experience. So get good grades, work in the field, basically.
So do most people have to retake classes then if they got a low grade?
Not always. Difficult. Not always. The Ogden Technology College and Davis Technology, or Ogden I should say, is a little bit more lenient on grades, but Weaver State and Davis Technology care a lot about grades. So if people aren't getting in and everything's done, that's when they'll start retaking classes. So let that fuel you, because you're paying a lot of money to go to college. Say, I am not going to pay to take this class again. That's how I just motivated myself to not need to do it. Get a good grade and be done. And get them done and with Mr. Bradle.
Right, 4th and 8th period next year. You guys can save yourself
It's a deal.
$2,000, what, $2,400, something like
It's
that.
like $2,500 per semester, though. Yeah, it's a lot.
And it's a 2 semesters, so they just saved themselves $5,000.
Yep.
And my students this year are doing great. I only have 8 students, And on their Module 8 exam, they scored a 93 average. And at the, if you take it at Weaver State,
The average is terrible. It's terrible.
is a lot less than that.
That's a big one. You'll see people have to retake in Weaver State. That and math. Get your math done too.
Does anybody have any further questions for Christie? All right, let's thank her for coming. Okay, so type up your report, have it ready to go for next time.
I started laughing.